So, what does a stable, supportive relationship actually do to the body over time in terms of stress and immunity and even cognitive function?
It basically, it's a little bit like bathing that body and that brain in the most wonderful, positive, healthy set of chemistry, essentially. A very stressed child obviously has very, very high cortisol. They tend to have what's an enlarged and very overactive amygdala. If you remember, the amygdala is where fear sits, where risk detection sits, and children who have been brought up in an environment where they're constantly at risk, that's on all the time, and it's a very unhealthy state to be in. Cortisol suppresses the immune system as well, and cortisol blocks the effect of the positive neurochemistry. So it's not a helpful chemical to have in your body long term. So by being in a good relationship, a relationship which is where your carers are sensitive to your needs, they're empathetic to your needs, one where they follow your lead in terms of what their needs are, so a child-led environment, one where they're supportive but not overly intrusive, one where we do have appropriate touch in terms of what the child can deal with, eye gaze, all these sorts of things, then we see cortisol lowers. We see that, yes, the neurochemistry or the positive neurochemistry comes up. That begins to start altering the architecture of the brain. We see the amygdala starting to reduce, and that constant risk reducing, that perception of risk reducing.